Now, as a specialist prosthodontist, I'm trained in how to deal with the problem over denture. Now, if you have a denture and you're happy, and some people are, 20% of people will be very happy with a full lower denture and not want implants. They'll be able to eat and function and be very comfortable. But there are a percentage of people out there that are very uncomfortable and unsatisfied with their denture. Now, we have different levels of treatment. We're not just an all-on-4 Marlow clinic. We can provide different levels of care. We can provide a suction denture, suction effect denture. We can provide implant over dentures on 1, 2, 3 or 4 implants, or we can provide a fixed all-on-4 style of fixed bridge on 4 implants. And they all have their advantages and disadvantages, and an implant over denture on 2 or 3 implants can provide a high level of satisfaction for most patients without spending the money on doing a expensive Marlow style $25,000 fixed bridge. Now, my research project was comparing satisfaction between implant over dentures and fixed prostheses. And just on average, a 2 implant over denture out of 10, people will score it about a 7.5 or 8 out of 10 in terms of satisfaction level. Whereas they started with a 3 or a 4 out of 10 as a simple denture, and they would score the fixed bridge about a 9 or 9.5 out of 10. Now, the difference in cost is substantial. We can do an implant over denture for 2 implants and 2 attachments for about $4,000. Now, that doesn't include any work to the denture as such, but that's to provide 2 implants and 2 press starch and placing the denture for about, again, a $4,000 treatment, as opposed between $20,000 and $25,000 for what is on average 1 out of 10 or 1.5 out of 10 on what we call a VAS, visual analog scale of satisfaction. So you have to ask yourself, is that $20,000 worth 1 point or 1.5 points out of 10? So what I'm trying to say is there are other options of treatment that people on a budget that we can help them. We can improve their comfort, we can improve their satisfaction without breaking the piggy bank. And as I said before, there is another option of just doing no implants at all, and this is just a suction effect denture where there's a sophisticated impression technique to try and provide an air seal. Often the denture extends a little bit further up the back here to go underneath the cheek muscles to get an air seal and effectively a suction effect. Now, some people will place mini implants. Now, mini implants are relatively inexpensive narrow diameter implants. They're about 2 millimeters in diameter, but they're only one piece. So if you place them too deep, sometimes the gum grows over the top and you can't wear the denture. And sometimes if you don't place them deep enough, they stick too high into the denture and weaken the denture. Now, the other problem is that the mini implant only provides retention. It doesn't provide support. So when you bite down, it's purely on the tissue. And it only provides retention, so it stops the denture from lifting off. Whereas with a full-size implant, these implants actually provide some support as well. So when you bite down, you'll have some support protecting the tissues, biting onto the implants, rather than just retention. So it's the difference between a full-size attachment and a mini implant. Now, mini implants often provide high satisfaction to patients in the short term, but there's very limited studies in the long term. The one study that does follow them up for 5 years reported that only 28% of patients at the end of the study would do the treatment again. So, what we can also offer is a fixed on 4, where we have 4 implants and a titanium reinforced bridge with high quality denture teeth. So that's what most people provide as a all-on-4, which is titanium framework. And that could be simple laser welding, or it could be the correct machined out of one piece titanium, which is computer designed, machined out of one piece with high quality resin teeth. Or some people cut corners and just have a little bit of laser welded wire, which looks like coat hanger wire, for a framework that is done quickly. This is a case we did a number of years ago. Sometimes you only need 3 implants in the mandible. We've done about 30, 40 cases with 3 implants in the lower jaw. Very high success rate. And again, what we normally do is we place the implants either for the overdenture. This is the lower jaw looking down from the top. This is the nerve at the back here. And so the nerve travels in the jaw and finishes here, so we have to put the implants in the front part of the jaw We could put an implant either side here and have 2 implant attachments. We can put an implant in the middle, or we can put 2 implants in the middle and 2 attachments, or we can have it fixed on 4 implants. But we need to stay away from the nerve on each side. So what I prefer to do these days is to put 2 implants here for a 2 implant overdenture as a minimum treatment. Sometimes we'll put a third one in the middle here for more retention and more stability, or we can put either 1 or 2 additional implants to have a fixed bridge. So again, this is a fixed on 4 style where we have the metal substructure, a little bit off the tissue, a lot of machined titanium holding it all together, high quality resin, high quality denture teeth. Now I call that a fixed on 4, not an all on 4, because we have 4 implants. I don't intentionally tilt the implants over, that overly complicates the surgery and the restoration. So we tend to keep the implants actually aligned, so I don't use the term all on 4, I call it fixed on 4. And we can do that treatment for $14,950 all up. So that would include if say there's 2 or 3 remaining teeth to be extracted, failing teeth, we'll do the extractions, place the implants, and we do a provisional bridge. We do that in 1 day, usually about 3 hours. You can walk out with some fixed temporary teeth on the implants at about 3 hours worth of treatment. And we charge $8,000 normally for that, and then we'll get you back and then take the impressions and make the final bridge. But our total fee on that is $14,950. That's the whole lot, not just for the provisional. That's for a fixed, permanent, titanium, genuine Noble Biocare titanium framework on the implants. So what a lot of people are doing when they're doing a teeth in a day is that this is the high quality machined titanium interface that fits between the implant and the teeth. This titanium is computer designed and milled out of one solid piece in a very expensive factory overseas. And they cost a little bit more money, but more importantly, they take time. This has to be designed, the data goes away, and it's milled out of a solid block of titanium. That really takes about 2 weeks to turn around. What people are doing is they're just getting some laser welding of some titanium bar, chop it up, laser weld, chop it up, laser weld, and then bonding some teeth. Now the problem is that it's very poorly supported, and quite often over time the resin fractures on the titanium because of the design. It's just a simple bar, much higher fracture rate. Now you can do this in a day simply because it's just chopped up, preformed stock bar and laser welding. So most medium labs can actually laser weld these days and make you something overnight, but to me that's a provisional. That's not a final restoration. To me this is the provisional, the final restoration. So the final restoration has a better support, more meat, more substructure to hold up the teeth, and so that the bar doesn't fracture over time. Now again, this is what a all on 4 on the maxilla looks like. This is where the teeth have been removed, the gum has been chopped back, and again this is denture teeth on resin on a, hiding in here is the titanium bar. And there's already a crack in this after 2 or 3 years because it's very poorly supported. Again, teeth in a day, you can't do a milled titanium bar as a substructure with a better design because they just take 2 weeks to make. This laser welding can be done in a day, but the milled version can't be done in a day, so therefore you can't make that. Now, I'm not a huge proponent. I much prefer in the upper jaw to keep the tissue. I want to keep the gum and the bone and put more implants in, and what we'd normally do is we'd have 6 implants, retain as much tissue as possible, and design the teeth. Now, this is just a plastic prototype. We would then have a metal substructure with porcelain painted over the top. So this is computer designed, this is milled out of one solid block of alloy, and the porcelain is painted and baked and layered and then dried in, and that is a all on 6, and that is 6 premium implants, metal substructure, porcelain on top, and we can do that for $25,000 all up. That's implant surgery, provisional and final restoration.